Good morning, everyone. I'd like to call this public hearing of the House Aging and Older Adult Services Committee to order. For attendance today, let's ask each committee member present to introduce themselves by stating their name and the district they represent.
Hello, Representative Gleim from the 199th District in Cumberland County.
Representative Joanne Stair from the 107th District.
Steve Menser, Lancaster County.
Rep. Madden, 115th Legislative District.
Rep. Tara Khan, 194th District.
Good morning. My name is Dan Williams. I represent the 74th District in Chester County.
Arvin Venkat, 30th Legislative District, Allegheny County.
Jim Prokopiak, 140th District, Bucks County.
Thank you. And joining us virtually, Rep. Abney and Representative Benham. I'd like to remind members of the public watching at home that our members serve on multiple committees, which often requires them to juggle various obligations. Occasionally, committee members' meetings may overlap, so don't be surprised if you see members coming and going during the meeting. Please be aware that this meeting is being recorded, and members and guests should silence their cell phones and electronic devices. Today's hearing is a continuation of last week's informational meeting on Alzheimer's disease and dementia. During this session, we will discuss bipartisan and bicameral legislation that is aimed at creating a permanent office infrastructure within the Department of Aging. As you are aware, this legislation holds a special place in my heart, as both of my parents died from complications of vascular dementia. My dad early on at 56, and my mom was diagnosed at 69 and lived till 82 with the disease, and we watched the debilitating effects of it. We watched how it affects families and friends, and I'm so grateful to the administration for setting up this task force. It is certainly needed. And to highlight the significance of this crucial legislation, we are joined by two outstanding individuals from our Commonwealth. First up is longtime champion for older adults with years of dedicated leadership, fresh from the governor's historic unveiling of the new master plan on aging, titled Aging Our Way. We have Secretary of the Department of Aging, Jason Kovulich. And because we are running a absolutely bipartisan, bicameral session and working on this bill together, we're also going to have Clayton Jacobs speak, the Executive Director of the Greater Pennsylvania Chapter of Alzheimer's Association. Chair Menser, do you have any opening remarks?
Thank you, Chair Madden, and thanks for scheduling this hearing on HB 2400 and SB 840, and thanks to Secretary Kovulich and Mr. Jacobs for coming to the hearing today.
Secretary Coolidge.
Good morning, everyone. It is a pleasure to be here with you, Chairwoman Madden, Chairman Menser, members of the House Aging and Older Adult Services Committee, and our valued partners at the Alzheimer's Association. I'm pleased to have this opportunity to be part of a great collective call, one that has been sounding for many months and years, to acknowledge and address the needs of the growing population of individuals living with Alzheimer's disease, related dementias, and their caregivers. Just a little over a week ago, my team and I were proud to join Governor Shapiro and legislative and community partners to launch Aging Our Way PA, our first strategic plan for older adults. During the development of this plan, engaging with thousands of Pennsylvanians through hundreds of meetings in every one of our 67 counties, we heard loud and clear the needs of an invisible community, the caregivers and their loved ones living with Alzheimer's and dementia. They have to be seen and heard, and they deserve a coordinated commitment in state government. This is why the Shapiro administration and the Department of Aging are seeking $1.9 million to establish an Alzheimer's, dementia, and related disorders infrastructure in our state governance at the Department of Aging. As we know, this disease touches millions of Pennsylvanians in life-changing ways. In 2020, there were 280,000 Pennsylvanians with Alzheimer's disease. This number is projected to increase to 320,000 by 2025. In 2022, there were 404,000 caregivers providing 646 million hours of care to their loved ones at an estimated cost of $10.7 billion. Pennsylvania needs to do better in supporting these adults and their caregivers. Our advocacy partners, sister agencies, and local governments and community partners all deserve dedicated structure within state government where they can collectively strengthen our efforts towards meeting their needs. Currently, no state agency has full programmatic oversight over ADRD. The department has led efforts such as the creation of the state plan for ADRD and our annual ADRD forum, but we currently do not have the resources to fully engage in this important work, even though there has been a significant increase in the number of older adults and their caregivers. This new office will align with the work the department is already doing with aging programs such as the PA Link, our PACE program, and our caregiver support programs. It will allow the department to do better and support this growing population and their caregivers in their communities. The department will leverage these dedicated resources to develop programs, provide education, outreach, and supports to individuals, their families, their caregivers, aging professionals, and the general public to provide the best opportunity for living safely in communities. The department will continue to partner with the National Alzheimer's Disease Research Centers located at the University of Pittsburgh and the University of Pennsylvania to educate medical professionals and stakeholders and the general public on ADRD. The department is supportive of legislation which would align the governor's budget proposal in establishing an office in the Department of Aging and the creation of an advisory committee to guide and direct its work. The advisory committee will bring all of the necessary partners and stakeholders to the table and to support the department in the implementation of the state's Alzheimer's plan. We will work closely with our sister agencies, the Department of Health and the Department of Human Services, on all of these activities. Both agencies are proposed members of the advisory committee, with the acting Secretary of Health as its co-chair. We are committed to working with all of you to make this proposal in state government a reality as we work to create a Commonwealth where every Pennsylvanian can age their way with the support, connection, and dignity that they deserve. Thank you.
Thank you, Secretary. Our second speaker has been a constant voice and advocate for those families with loved ones with Alzheimer's disease and dementia. Mr. Clay Jacobs, who serves as the Executive Director of the Alzheimer's Association Greater Pennsylvania Chapter, please begin.
Thank you, and good morning. As mentioned, my name is Clay Jacobs, and I am the Executive Director for the Greater Pennsylvania Chapter, but here representing both Pennsylvania chapters. First, I would like to thank and acknowledge Chairwoman Madden, Chairman Menser, and members of the House Aging and Older Adult Services Committee for convening this hearing on the ADRD office infrastructure, specifically House Bill 2400, and also as we look at Senate Bill 840. I would also like to recognize and thank Secretary of Aging Jason Kavulich, who is testifying for his leadership on the issues not just today, but in all of his work over the past decades. Last week, this committee was gracious enough to hear from leading researchers, clinicians, public health experts, and families about the impacts of Alzheimer's disease and dementia. Today, as we discuss proposed initiatives that can make a difference for Pennsylvanians, it is my privilege to share just some have seen as a result of similar infrastructure efforts. While Pennsylvania has one of the largest older adult populations, world-class research institutions, many quality care providers, a strong network of area agency and aging, and more, it lags significantly behind peer states in its coordinated approach to dementia. As a result, our most vulnerable citizens, often left to navigate the disjointed system all on their own, doing the best they can, and this is before we even consider the significant advancements coming and already here around risk reduction, biomarker testing, FDA-approved treatments, and more, which we know will impact patient care in the community in the near term. I say this because other states have recognized that the policies and programs needed to effectively confront the Alzheimer's public health crisis are wide-ranging and cross multiple state agencies, as you've already heard today, that requires significant interagency coordination. In contrast, Pennsylvania last updated its state plan for Alzheimer's disease and related disorders over a decade ago, and the majority of recommendations included within have largely remained unaddressed or are now out of date, given significant scientific advancements, and that's despite significant efforts across multiple administrations. This is also the reason why most other states have created a permanent Alzheimer's council or task force to monitor the state's response to Alzheimer's through implementation of their state plan and to determine what actions are needed to be addressed in future plans. That's what makes today's discussion so important, including House Bill 2400, as it is so vital and timely. A coordinated state approach and adequate resources enable the state to respond to the Alzheimer's crisis with recommendations tailored to meet the most timely and critical issues, and most importantly, with direct action and accountability. As federal and state policies change regularly, coupled with emerging research and new programs, any plan can quickly become irrelevant and ineffective if there are no reports on implementation status and if it's not regularly updated. Last week, you heard about what research and public health experts consider vital to addressing dementia now and in the near future. Yet currently, Pennsylvania allocates $250,000 towards dementia-specific disease education, outreach, and programming. With more than 280,000 Pennsylvanians age 65 and over just living with Alzheimer's disease, that is less than $1 per every Pennsylvanian diagnosed, and this is putting Pennsylvania even further behind peer states. States that have invested in dementia-specific public health infrastructure, similar to what has been proposed for the Commonwealth of Pennsylvania, have not only improved the state's response to this growing crisis, but these states have also leveraged their investments into increased access to federal funding and direct benefit to their citizens. This approach is not new or unique. In fact, 28 states plus the District of Columbia have a state-funded position within state government, often referred to as a dementia services coordinator. Due to scientific advancements and this need, in October of 2022, the Alzheimer's Association actually hosted the first annual Dementia Services Coordinator Summit in Washington, D.C. This was the first of such gatherings from states across the nation, where these coordinators were able to share and learn more about responses happening throughout the country. In addition to practical discussions about implementation, the Administration of Community Living, which is housed within the Department of Health and Human Services, presented to attendees about federal grant opportunities to aid in that implementation, including the Alzheimer's Disease Program Initiative, or ADPI grant. They're available to state agencies to implement policies and support the delivery of critical programs and services that support dementia caregivers. As I said, I wanted to share a few examples because it is tremendously important as we look at the potential impact of this investment. One example is if we look at the state of Wisconsin. Between 2009 and 2022, through their dementia services coordinator working within the Department of Health Services, they secured $4.7 million in grant funding from the Administration of Community Living. Then nearly $5 million has funded various projects like a memory screening pilot program to improve early detection and diagnosis, which became one of the tenets of a highly successful county-based dementia care specialist program there. Additionally, funding from ACL's ADPI grant supported the adaptation of that dementia care specialist model for tribes and the Hispanic communities in specific portions of the state. That role didn't stop there. They secured rounds of funding from the CDC and prevention, specifically the Building Our Largest Dementia Infrastructure Act. The first award, awarded in 2021, provided Wisconsin's Department of Health Services with $300,000 over 3 years per year. The second award will provide the state with nearly $2.5 million over a 5-year lifespan to use a public health approach to address Alzheimer's disease and related dementias by implementing the CDC's Healthy Brain Initiative, state and local public health partnerships to address dementia. The plans to make a more significant impact are out there, not only in the Commonwealth, but across the country. That plan is a step-by-step, evidence-based guide on how to improve health outcomes and issues related to cognition. At the end of this cycle, that dedication at a state level will have meant an $8.1 million in additional federal funding to address the Alzheimer's disease crisis in Wisconsin, all of which began with the type of discussion we're having today. States across the country are transitioning their state plans to direct funding of services, creations of programs, as was mentioned by Secretary Kavulich, and providing direct support to those living with dementia and their caregivers. For example, Kansas and Tennessee have recently created new dementia-specific respite programs administered by their state's area agency on aging. Missouri, over the past 2 years, has nearly tripled the amount provided to their dementia-specific respite program as well. Other states, including Virginia, Georgia, and again, Wisconsin, are creating innovative care and delivery models for people living with the disease. The state of Virginia has created 2 separate appropriations specifically to fund case management for individuals living with dementia. The University of Virginia and the Martha W. Goodson Center on Riverside Health receive state funding for dementia case management to ensure a comprehensive care coordination management plan to focus on an individual's underlying dementia diagnosis. The end result of all of these efforts is improved quality of life for people living with dementia, a reduction of strain on their unpaid caregivers, and enabling people living with the disease to remain in their homes as long as it is the most appropriate setting. In Georgia, the state has partnered with places like Emory University to create a statewide program called Georgia MemoryNet that expands access to early and accurate diagnosis of Alzheimer's disease and other dementias, and to help support those living with the disease and their caregivers. Additionally, it trains physicians to properly screen for the disease and collect useful data which the state can use to better support those living with dementia. Created in 2018, the Georgia MemoryNet program has 5 assessment centers in operation across the state. Today, the program is more timely and necessary than ever before, as current FDA-approved treatments are focused on the earliest stages of the disease, making early detection and diagnosis even more important. And again, as we've shared these examples, back in Wisconsin, they've focused significant funding and effort on collaboration with county governments and county infrastructure, with the 2013 creation of the Dementia Care Specialist Program. They provide resources to Wisconsin counties and tribal nations to fund this work everywhere. And as we look at that, each of these tribal nations and special communities are receiving supports tailored to their need. This program provides those resources dedicated to support people living with dementia and their families by providing dementia-specific information, care planning, cognitive screenings, county employee training, and consumer-directed personal care. Just some of these things show the potential for a more coordinated and more intentional approach that is resourced appropriately. This investment that I share through these other states, including Wisconsin, has made on supports and services to assist individuals ultimately saves state Medicaid dollars as the need for more expensive institutionalized care is delayed or even eliminated. The common thread in all of these aforementioned programs or state-based efforts is that they began there with an allocation of specific resources and the development of infrastructure designed to holistically approach dementia. This was coupled with a commitment at all levels of government to enact real, meaningful change for residents in each state. This level of understanding and commitment these states with public health best practices and opened up avenues for additional public and private funding necessary to implement said programs. With a state plan that began a decade ago, this legislation puts us on the precipice of great positive change for our residents impacted by Alzheimer's and other dementia. At this moment, through the governor's proposal on this legislation, we have a chance to improve care and support providers, family, and those living with the disease, while also increasing revenue and resources for the Commonwealth. This is what needs to be the focus as we consider this legislation. As the leading advocacy organization for families impacted by all dementias in Pennsylvania, we hear all too often the familiar refrain you heard last week. We did the best we could with what we had. Each time a family shares this sentiment or discusses the added layers of stress and time needed to navigate and coordinate care on their own, we know that there is more we can do. At this time, under this administration and the Pennsylvania General Assembly, we have the ability to change that experience for millions of residents and to forge a better path as we enter a new era of treatment and quality care in our community. So thank you again, Chairwoman Madden, Chairman Menser, and members for this time and for the invitation to be here with you today.
Thank you, Director Jacobs, for your insightful testimony. We're also joined by 2 more of our colleagues, Representative Derisha Parker and Representative Napoleon Nelson. And if anyone has any questions, please let Chuck know. Secretary Kuvulich, we heard last week that Alzheimer's and dementia is a disease that spans across a continuum and has a tremendous ripple effect on the families, the health systems, the communities that support them, and so much more. As the person who will lead this effort across the state, you all have to excuse me. I got in very late at a flight from Denver last night, and I'm not finding my words today, so be patient. As the person who will lead this effort across the state, can you share your plans to bring other state agencies together to assure accountability in the process, and how will you ensure that the disease is addressed holistically?
Thank you. I really appreciate that question. That is why in our proposal we strengthened the advisory council and made it something that would really help govern the work that's being done at the department. Not only are we sharing it, as myself and the acting secretary would be chair and co-chair, we're working with the association to bring in other stakeholders that really will help us look at intervals to see if we need to update our state plan. Will help us push the state plan that we've had for a number of years that former Secretary Duke developed with the association and others to make sure that we're implementing the goals in that plan and incorporating that into the larger overall plan that we have at the department. It's really about empowering the stakeholders to help us inform our work and direct our work. And that is something that we wove right into the original proposal. But with the 52 area agencies on aging and our ability to reach out and partner throughout the Commonwealth, the small office that we're going to create in our department, which is a director and 3 employees, will be able to put those resources to work with the area agencies on aging and hit every community in the Commonwealth where the resources are needed, where the boots on the ground workers are, and where we can use our partnerships to our advantage to make sure that we're making an impact on this population.
Thank you so much. Chair Menser, do you have a question?
I do, Chair Madden, thank you. The Senate Bill 840 had a price tag of $750,000 in it for the origination of the personnel, and the House version did not have an amount. And now I see that there's a $1.9 million amount for the origination of the department. So I'm wondering how this would compare to, say, Wisconsin's dementia service coordinator. How specifically is that money going to be spent? Is it going to be a smaller amount at the beginning and then increase to $1.9 million? Either one.
So the $750,000 is woven into our request, and that really does cover the personnel costs associated with this. The vast amount of the resources that we're requesting go to programming in local communities and support the work in local communities of developing programs, early detection, respite resources, et cetera, for the local communities to have access to, and also supports the academic work that needs to be done in research, research in medication, research in early detection, research in other forms that like that have been mentioned today. So the vast majority of what we're asking for is for programming and research development and making sure that we're making an impact on the local level and really minimizing the cost here in Harrisburg.
Thank you, Secretary Kovalich. I think it would be very helpful for our members on the committee to have some kind of an outline of how that $1.9 million will be spent. The reason being that this is an amount we have just heard. I know it was in the governor's budget, but it would be helpful for us while we deliberate as to how we want to handle the legislation. If we could have an outline of that, so if anybody can provide that. Also, Mr. Jacobs, if you could provide us with what Wisconsin is spending to administer their Alzheimer's department, that would also be helpful.
Certainly, and I think one of the important components as we talk about this, many of the states that I've mentioned have made these initial investments almost a decade ago. And part of that component was then allows them to search out and connect with other resources. So many of the federal grants, as I mentioned, through the CDC and others, states have to have shown that they've put dedicated resources to working across state departments and agencies, including Department of Health and Human Services. So most of the resources I shared there are direct funds from federal government programs to then make a difference. So certainly as we, as your question, Secretary Kuvelich, around sharing some additional around the proposal, certainly as we looked at the House bill, also included at the time, or the Senate bill, when it was introduced, included some resources around legislation around early detection diagnosis, which had been passed but not resourced, but that plan for today. And then we can provide some additional information on how initial investments at a state level then allowed additional resources for innovation, direct services, and even expanding programming. It'd be our pleasure to be able to do that.
Great, thank you very much. And I'll give the chair.
Thank you. I have one quick question. What would the Alzheimer's Association recommend as a priority of the initial investment in
Absolutely.
structure?
And thanks you so much. I think, as I think of it, there are a few things early on as we look at what are larger efforts within the administration and the department. Certainly, there are things that are already laid out as here's a pathway, here's some priorities that make sense early. I think, I just referenced legislation that actually passed last session around early detection diagnosis for physicians and the community. And that resource, while a website was created, most of the implementation didn't occur due to a lack of resources. And so if you think about those things, there are folks navigating or seeking a diagnosis now. There are laws on the books about that, but not the resources or coordination in a way. And then I do think one of the most vital pieces that Secretary Gavulich mentioned is none of these efforts are accomplished in any one place, right? It requires leadership and voices at a state level, at a county level, at a community level. And so I think one of the most important things, if passed, is actually that stakeholder group, that coordination across state governments and others. We know from early diagnosis to late stage care currently, those services and supports are overseen by a myriad of agencies. And last week you heard about how challenging that navigation can be. That is work we need to start today because families have been dealing with it. And many of those families have been looking for more hope for over a decade now.
Thank you for that. I'd like to mention that Representative Powell has joined us, and we have some questions from members. Rep. Khan?
Thank you, Chair Madden and Chair Metzger. Secretary Gavulich, Mr. Jacobs, thanks so much for joining us. And Secretary Gavulich, thanks for coming to my district. We spent a day together. The Secretary came to our district, and we toured some of the infrastructure we have for older adults in our community. And we met with the villages. We met with New Cortland Center, Cathedral Village, Journeys Way. It was a really great day, and I really appreciate your time and concentration on supporting older adults in Pennsylvania and really getting a boots on the ground assessment of what are some of the resources in a great community like ours in the 194th. And I want to thank Chair Madden, our former Chair Kim, and Chair Steve Samuelson for their leadership. I've joined them as a co-prime sponsor on House Bill 2400, the Alzheimer Infrastructure Bill. And I think with Pennsylvania having the 5th highest number of older adults in the nation, making sure that our caregivers are supported. I think we have over 2 million older adults in Pennsylvania, and it seems like the rates of Alzheimer's and other related dementias keep rising every year. And so my question to both of you is, as we are looking to support individuals that have, such as, perhaps myself, that may one day find myself finding to need to support one of my parents that perhaps develop Alzheimer's or other related dementias, what are some of the challenges that you see currently in Pennsylvania to supporting those caregivers in terms of the resources that are currently available? And what are some of the opportunities that you see that can be part of that? Thank you.
Well, thank you. And I'm glad we're talking about caregivers because that's really what this is about. It's supporting caregivers on a local level. It's supporting caregivers in their communities. It's providing them with resources and tools, which we don't have right now. So we have 404,000 caregivers that are unpaid. That's roughly all of them are working a part-time job at 21 hours a week on top of their other job and on top of doing all their other life activities. So we have these caregivers that really need resources, that really need respite. They need a break. And if they don't have a break, then they can reach the breaking point, which means an older adult or an adult who's living with the disease will have to go into a higher level of care. So, I mean, caregiving is one of the most important things that we need to focus on. We need to make sure we're providing them with the respite, resources, educational materials, and other tools that they have asked us for, so that they can support their loved ones in the community. We could not absorb the cost of paying for all of these caregivers to come into our system. So we need to make sure we're doing our part to support them out in their communities now and uplifting the concept that they're out there working unpaid. We've all taken care of members of our families. I'm sure we all will have this opportunity at some point to take care of our family members. We have to make sure we're supporting this community. Like I said, caregivers need support, not just in resources, but they need support from their peers and people that understand what caregiving is, and they need to be informed about how to make sure that they're properly caregiving. We have an incredible professional workforce of caregivers out there, but we also know that this unpaid group of caregivers is a huge asset to Pennsylvania, and we have to respect and keep supporting it.
Certainly, and I think that's incredibly well said and would hit on most of the pieces we talk about the need for caregiving. And it is something often there's a perception of, but we know 70% of people living with this disease live at home. And so does community-based services and support and planning through that care continuum. As we mentioned, things like dementia care navigation. For other diseases, it would be unheard of to leave a physician's office with an 800 number, but no discussion about what's next. And we hear from families that is normally the default when they're dealing with this. Or don't worry about it, right? It's dementia, it's those pieces. So I think that idea of how do we help educate, inform, connect along the disease process, as the Secretary mentioned, is incredibly vital for caregivers. I'd be remiss also if that when we talk about this work, there has been some things that have changed since even the initial state plan. We are on the precipice where in the coming years, right now there are 2 FDA-approved treatments. In fact, today there is a hearing on the 3rd. We expect things like biomarkers, some exist already, whether it's through MRIs or others, but things like blood-based biomarkers, that research is happening in the Commonwealth's research institutions. In Pittsburgh and Pennsylvania, we're leading the globe on identifying how do we diagnose and treat this disease earlier. But what that means in the coming years is that you have to have discussions even around risk reduction in our 40s and 50s, that people may get a diagnosis in their 50s with a plan to then mitigate or reduce the impact of this disease. And so the entire population and aging we work with, we know there will still folks who progress, that will need care, that will need, their caregivers will need support. We're at a point where risk reduction, treatment, and diagnosis is changing. It is the precipice of the types of impact we saw in cancer and HIV/AIDS in the 80s. And so we not only must address the things we know are issues now, but be flexible for what's to come. Because right now it's that something so serious happens that you can't ignore it anymore. But what does it look like if even 5 years you go for a routine blood panel and you know you're at higher risk for the disease and there's things you can do today, things you can do to plan, things you can do to talk with your family. All of those things are what infrastructure that is looking at what are the issues and working across state government, bringing together public and private partners. That is the potential not only to respond to, but as the Secretary mentioned earlier, to truly lead in this work.
Thank you. Question from Rep. Gleim.
Thank you, Madam Chairman, Chairwoman. I'm just really happy to be here today, and I want to thank you for your testimony. I am a co-chair in the House of the Rare Disease Caucus. And a lot of the data that has been coming out in that caucus, it is surrounding the fact that it's so difficult to even get a diagnosis to begin with, and then the time it takes to get the treatment. There's a lot of data around that. And I was, going through the plan, and it looks like, trying to get the history here, that there was an executive order in 2013, and then there was an actual plan in 2014 where you're saying that the majority of the recommendations included have remained unaddressed. Do you actually, first of all, do you have a copy of the original executive order? Because I couldn't find it. First of all, you don't have to give it to me right now, but I would like to get that. And then, do you have a list of all of the things that were unaddressed from 2014 that are going to be basically put into this new plan And why did nothing happen between 2014 and 2024?
Well, thank you, and I think that highlights the call for investment. There was no investment made in the plan over a number of years, so therefore, a lot of the things that were incorporated into that plan did not come into fruition. So, for instance, the department created a task force around this, but there was nowhere. It was not in statute. It was not anything in anything but recommendation that the department convene this task force. We're asking for this committee to be created to guide the work, to be able to, make sure that the plan, like the plan you referenced, is being incorporated and holding the department accountable to help other sister agencies make the plan a reality in communities. So it really speaks to the call for resources that we need to make programming like this happen, make it real in communities. The little bit of resources that we've been able to carve out has supported the Alzheimer's Association in doing work in the communities and continuing to outreach into communities, educate communities. But that's really just a minimal investment in what should and could be happening in this space. We want to make sure that we have a robust system, that we're working with all our partners in this space to do programming like we do now with the Jewish Healthcare Foundation and offer dementia-friendly programs that are both evidence-informed and innovative in communities all throughout Pennsylvania. So there's many there's many partner agencies, there's sister agencies. All of us really need to come together to put the best foot forward with an investment to make sure that we're making a difference here in this space. And also, I would be remiss if I didn't bring up what Mr. Jacobs said earlier about the need for better navigation services. People need assistance in working through a very complex system. And with enhanced navigation services, we can get people to services quicker. We can get people to the experts quicker that they need to. And we really need to concentrate on that infrastructure of navigation, not just because it will help us at the end of the day get people to services, but because everyone has told us we need to improve that across the state.
Okay, thank you. So it does say in here that that we allocate $250,000 towards dementia-specific disease education and outreach currently, correct? And what you're basically saying is because the population that is contracting Alzheimer's or disease is increasing, that we need more funds.
Those resources are the resources the Department of Aging provides to the Alzheimer's Association for this work. But to do real programming in communities, to be able to expand the partnerships, we need an investment, yes.
Okay, and well, thank you for that testimony, and I look forward to working on this further. I'm new to the committee, so I am trying to get up to speed on the plan here, but thank you very much.
Thank you. We've also been joined by Representative Borowski, and we have a question from Representative Williams.
Madam Chair, thank you. Gentlemen, I appreciate your testimony this morning, and I want to jettison for a moment away from the empirical data and the accountability issues, et cetera, and I want to talk to you like two people who understand this disease from another perspective. Everyone in this room will eventually or has been touched by this disease in some shape, form, or fashion. Now, let me offer just a transparent statement in terms of what I think. I think one of the ways in which we demonstrate and model a really successful society is manifested in the way we care for our aged and our young and the most vulnerable a part of our societies. Having said that, I also believe that while the term has been popularized and probably now desensitized, a budget really is an indicator of where you are morally. And so my question to you is, I've looked at your ask financially, and I'm curious to know, is that really enough? It seems like a paltry amount for what we're describing as something so transformational in the lives of the aged as well as generations to come. And many of us in this room, this figure seems like a paltry figure in comparison to what we have and what we should be prioritizing. So now just take off your your secretary hat, take off your CEO hat, Mr. Jacobs, and talk to me about whether or not this really is enough money to effectively impact something that will transform the lives of everyone in this room and beyond.
Sure, I can certainly start, and I think the piece and why in my testimony I mentioned some of the other states is that what we've seen at a nationwide level is a prioritization of dementia in recent years. So around a decade ago as well, there was a national plan established. There has been a healthy brain roadmap on here are the steps that states and counties should take for well over a decade. There have been all of these things on here's how you can make a meaningful impact, and here are resources to do so. And so when we look at that, that has also meant for those years, in many of these cases, the Commonwealth has not even been eligible to apply because of the lack of infrastructure. And so when I talk about what is truly potential there, the Secretary, his predecessors have done yeoman's work on doing what is possible with the resources. They brought together stakeholders and other pieces, and yet those access pieces are out there. And so from our perspective, the truly transformational piece is tying into what we're seeing happen across the country elsewhere. We see that impact. We see what 5 years and 10 years makes in those. We see that it brings revenue and services and does those things. And so especially at this moment in time, that investment to even allow Pennsylvania to be a seat at that table is the single most vital important thing from my perspective, because then that helps determine what other resources and supports and can make a difference. I'd also be remiss if some of the things, because we mentioned earlier that Pennsylvania is one of the few states with 2 federal research centers, never mind other academic institutions doing incredible work. Those centers, as an example, things like research funding through the NIH have increased 7-fold in the same 10-year period. So that research and access and other pieces are happening, but only in those pockets. And so this type of work to really put a meaningful, intentional piece just opens up opportunities. So from an investment, this is the right thing at the right time, but it does also mean that the truly transformational pieces will come. And from the Secretary's point, not from a single point of view or a small point of view, but by those who are brought to the table to help then build what that is. Because everyone's experience with this disease is different, whether you're a state government agency or a private entity or a caregiver, somebody living with the disease. If we want to build something that makes a difference for families and communities, communities need to be a part of that discussion in a meaningful way. So thank you for asking, and hopefully that gives our perspective a little bit.
Thank you. A friend of mine is fond of saying that, Pennsylvania doesn't always do things first, but we can do things fast and we can do things well. And right now what I see is an opportunity that we have to basically jumpstart ourselves and get to where we need to be. When you look at Georgia, when you look at Utah, you look at other states, and we have been looking at other states, they are further ahead with us in this infrastructure. And I think this is a reasonable starting place, and this is a good place to start to invest in this work and to build out an infrastructure quickly that can get us the resources that we need, that we can pull from other resources, as Mr. Jacobs said, that we can partner with other states to really further the work in this space, and that we can become a leader very quickly and in making sure that we're serving our population the best we can. So from my perspective, it is a good start. It is a reasonable start, and it was we thought our ask was in line with what we can do and what we can push out very quickly from the Department of Aging's lens.
I appreciate your work in this area, Secretary Kavalich. I appreciate your time in the 74th as well as my esteemed colleague. And thank you for your testimony, both of you today. Madam Chair, thank you.
Thank you. Okay. If no one else has any questions, thank you all for being here today. This coming Wednesday, the committee will hold a joint meeting with the Senate Aging and Youth Committee to receive a breakdown of the aforementioned Aging Our Way plan with no other than Secretary Jason Kavulich. Also on Wednesday, at the call of the chair of the committee, we'll hold a voting meeting on this legislation and several others. Thank you all for being here. This meeting is adjourned.
Thank you.